the one characteristic when we hire people that we ask our people and culture team to look for is folks that are willing to change their mind with new information.
Hello, everybody. This is Cole from the American Journal of Healthcare Strategy, joined by a very special guest in the industry doing really tremendous work, Meghan Gaffney. Meghan, can you please introduce yourself and a little bit about where you've been and what you're working on now?
Sure, Cole. Thanks. I am the CEO of VEDA Data Solutions. So we are an AI and automation platform working to build tools that help folks get access to care through finding the right information about providers and facilities. My background and kind of how I came to healthcare, I was in the policy space in Washington, D.C. for just under 15 years and was there during the time when the ACA was crafted. Saw a lot of really interesting perspectives from hospital presidents to patient advocacy organizations coming to DC, talking about what the future of healthcare should look like for people. But one of the things that they didn't spend a lot of time talking about was the data infrastructure that would be necessary for folks like you and me to be able to find the right provider and access care. And so I saw an opportunity to go into the private sector and build these types of tools to help enable folks to get access to care, to do that in an equitable way, and hopefully save the industry some money along the way.
Thank you so much for coming on. This is exciting because you have, like you said, you've been in that policy space 15 years. I mean, that's a long time. And then now you're in this tech space. I mean, you're winning awards for what you're doing. You've been featured in Becker's and Inc. 5000 and Ernst & Young. So, I mean, you're doing a lot of great things in the tech space. But then you have this health policy background. So it's so unique. I have to ask real quick, why go into the tech space, and was it challenging? I think there's a few reasons why. I mean, you think of, women in IT is a disproportionately small area, and then what's going on right now in IT with AI and ML and a lot of new technologies and a lot of competition. So what caused you to go in that direction?
Yeah, I mean, like a lot of entrepreneurs, it was a personal experience. So imagine 2009, healthcare is the only thing we're talking about in Washington on a daily basis. And I worked with senior appropriators in the House, which meant, I was in a lot of really wonky rooms where folks had access to all kinds of data and information about the health system. I also had just had a baby. And my daughter had some health issues and needed to find specialty care. And I could not figure out how to get an appointment with the right specialist for her and get her treated quickly for anybody that was covered in my insurance plan. And I just had this epiphany that if I couldn't do it, literally sitting in the halls of Congress as the entire healthcare universe is wrapping around me with lots of access to information, great insurance coverage, then nobody could do it. And so I think we've all had those experiences. You get on your health plan's website, you're looking for a dermatologist or maybe a speech therapist for your kid, and you're making phone call after phone call. I recognize at that time, for me, it was a frustration, but for somebody who's managing really chronic healthcare condition or in a behavioral health crisis, or maybe they're a mom or dad working a couple jobs and trying to make these phone calls in between the hours that they have to go to work each day, can really be a barrier to access that people weren't thinking about. And so as I dove in to find that solution, I was not a technologist. And so I did what most people do is I started talking around the water cooler, and had a tap on my shoulder from a colleague of mine who said, hey, I have a really good friend. He's an astronomer. He's building AI tools in radio astronomy and is looking for a new gig. You guys should talk. And it was that kind of 2-hour long phone call where we realized that some of the tools that were being used in academic science could be leveraged to help people. And that was really the genesis of VEDA. And since then, I've recognized the role of folks like me running AI companies when we're talking about things like health equity and using AI in a responsible way, that voices like mine really matter. And so that's what really keeps me up every day, kind of getting out of bed, charging forward at the next data challenge and making sure that we're building tools that really serve everybody in our community.
So that is so interesting. So 8 years ago is when you really started with the AI, right? And That was in what, 2018, I think, right? Or no, a little bit earlier than that.
Yeah, it was 2016, 2017, kind of end
So
of
AI was not really, I mean, in the news or
no.
whatnot. And then interesting partner as well, right? It wasn't like a healthcare AI like trained person. There
No.
wasn't probably many of those around.
No, I mean it was definitely before it was like the sexy buzzword that it is today. But in academic science, supervised learning and machine learning were being used all the time. And so things that seem new to this industry were actually really well established. Um, I can give you a little bit of an analogy. Have you ever seen the movie Contact with
Yeah.
all the telescopes, right? Jodie Foster.
Oh yeah.
That's called the Very Large Array. It's down in New Mexico. It's a real working telescope array. And my co-founder built software that's used there and at other telescopes all across the world. There's so much data that they're capturing off of these telescopes that they couldn't process it with people anymore. It was too much data to process manually. So they had to start writing machine learning scripts to clean up all the errors in the information. So for a radio telescope, if you drive by and your spark plug fires, or somebody's microwaving a hot pocket in the neighborhood down the street, it blows huge holes in the radio data, but they still have to try to do science anyway. They would manually clean that up. And what Bob did was he invented a software program that would recognize the errors in the data, automatically clean it up, and then knit those data sets together so that people could make discoveries about galaxies in the early universe.
Wow.
And we do the same thing with provider data today. Less maybe exciting than thinking about galaxy formation, but it's human created data, right? People are typing into EMRs, they're making phone calls. There's lots of error that needs to be cleaned up. And so we build a system that can find the errors, automatically clean them up, and then take disparate data sets and link them together so we can get the right answer. So it's a very similar approach, but it was really radical just a few years ago. And now I feel like we're finally at a time when AI is being embraced. And so that's really exciting for us as a company.
Oh yeah, because then you're a bit of ahead of the game, right?
Yeah.
8 years ahead of the game. So that is so interesting too, though. I mean, I wonder, how did you identify, I guess, that AI and tech was the solution to this problem?
We didn't have any other way to do it, is the answer,
Yeah.
because we were a small company. We actually got our hands on our first healthcare data set at a hackathon in 2016. It was just Bob and I that were there, and a sales guy that we brought along, and it was sponsored by Humana. So we went to Cincinnati. We went to their lab that was there, and they gave us some dental data. So it was a provider directory for their dental system. And we couldn't make 10,000 phone calls to try to validate the data. And we couldn't dig into a whole bunch of proprietary claims records. So we had to build something that was scalable and data driven. We had the opportunity that we could create some training data, but it was really through that experience we realized, okay, we can make a lot of impact fast. What could we do if we had a couple years to develop this and some investment capital and then really build out this machine learning way of doing things? But, it was necessity being the mother of invention is a saying for a reason. And that was exactly it. That was the only way we could try to tackle the problem. And the results we got were really good.
Because a lot of the work you've done, it seems like, has been before you had substantial funding.
Yeah, I mean, we raised very reasonable amounts of capital until our Series B in 2021. That was led by
Right.
Oak. And I think, for better or worse, it was a function of a capital environment where people were still skeptical about AI in healthcare. They didn't know, is this something that health plans or hospital systems would accept as a technology solution? And, we were a company that didn't fit a lot of the molds that investors on either coast looked for. Neither Bob and I have Ivy League degrees. Bob has a PhD, but it's in astrophysics. So, how does that work? It's not computer science. Our company was founded in Madison, Wisconsin, not in Silicon Valley or in New York or Boston. And so we looked a little different than the mold that people had seen before. What it made us do, though, was build things in a smart way that were scalable. It made the technology more affordable for our customers, and it helped us grow a company that was worth investing dollars in down the road because we were building it in a way that was scrappy and Midwestern kind of in its
Yeah.
nature.
I mean, that's what I love that too. I love because that's what AJ, HCS is. We're like
Mhm.
lean, very fiscally conservative, really trying to maximize our efficiency. And then as soon as we get, clients, it really exponentially increases our ability. And
Yeah.
so I love that. And then Humana is one of your larger clients as well. I
Mhm.
think that's been
That's right.
publicized. What outcomes have you seen that's been positive for them? How has this benefited Humana?
Yeah, I mean, I think they talked about it very openly with us in their press release around Medicare Advantage. One of the things that matters most to seniors is when they need an appointment, they have to find care. And so the accuracy of their directories, especially for Medicare Advantage, is a huge benefit for their seniors getting access to care and access to the right care. And so, in addition to the data just being accurate, we're able to also enrich it with things like subspecialty. So, if you need a neurologist, you really need to know, does this person treat Parkinson's or are they treating nerve pain, right? Two very different outcomes, both have a neurology background. So getting that kind of nuance and depth to the data really helps seniors get access to the right kind of care. And then it also saves them money because they don't have to use their team to do things like make outbound phone calls to figure out, the provider's fax number. They can use that team to be responsive to what their members are looking for, answering questions from members, engaging with providers to make sure that they're doing the right thing for the members. So all of that kind of focuses the money where it should be, back on the patient, which was a goal of Humana's, and we're happy to be a part of it.
Yeah, no, and I've worked with members and patients for many years, and that is one of the biggest issues, even for myself, right? I mean, we were talking about behavioral health earlier. It can be very confusing to identify behavioral health providers using almost any traditional database, right?
Yeah.
Because it's like, oh, they accept this insurance, but it's only for this type of appointment, and so it's challenging. I do wonder, how have you overcome some of those issues though with the different types of data, the different ways it's entered into different systems. I mean, I've seen a lot of this and it's kind of a mess at its present state, right? It's coming from all these different sources.
Yeah. I mean, it's 100% a mess. So you are correct about that. I think our focus on measurement has been a really defining characteristic of our business, which makes sense. We now have over 10 PhDs from the hard sciences,
Mm.
and they're used to measuring things over and over again. And it's okay for them to get it wrong culturally, right? You can publish a paper that says, hey, we used a telescope, we were trying to measure this galaxy, and it turns out what we thought was a really cool signal was actually an airplane. And you don't
Mhm.
get fired for that in science. In a lot of industry jobs, you do. And
Right.
so there's this cultural sense of, we try to get the data point right. We measure it internally. And if it doesn't work, that's okay. We just keep going back to the drawing board to measure until we get to the right level of accuracy. And
Mm.
that culturally has allowed us to kind of get past places where other people in this business have stopped before and said, well, we've tried these 3 different ways. Now we're done. I'll give you one example, and it's kind of funny. We have one former astrophysicist, very highly published. His entire job is to make sure that we can get the latitude and longitude on hospital buildings and outpatient surgical centers correct. That's it. That's his
Huh.
whole job.
Wow.
Because sometimes the addresses are really strange when you get to, not picking on teaching hospitals, but they have really strange address combinations and things like that. And it matters when a patient's plugging in the data to Google Maps to try to
Yeah.
navigate, which parking lot should I go into? Is there a handicap access to that building? So we're willing to invest in time and expertise in problems that I think other people think are maybe not a big deal,
Yeah.
or that they've given up on getting exactly correct. And it's because of the scientific culture that we're really proud of.
Well, and that's a question that I have though is that these individuals are not necessarily the cheapest individuals to employ, right? I mean, you and I know that knowing your stance on an equity, I'm sure that you
Mhm.
compensate everyone fairly. I've seen most ratings and reviews of your company are very positive, so paying everyone fairly, paying scientists fairly is challenging. How do you justify, and how do your customers justify that kind of ROI on that investment?
Yeah, I mean, I'll say 2 things. One is, paying people fairly is expensive. paying to constantly recruit and hire is also expensive. So the typical time an engineer stays at a startup is 18 months. I'm especially proud. One of the things that we've done since the very genesis of the company is we pay 100% of our employees' healthcare premiums for them and their family for a no deductible plan, which is
Wow.
an incredible investment, but it means that our employees aren't worrying about healthcare bills at work.
Yeah.
And so what we've seen is an incredible loyalty to the company because we value them, and folks stay and they're able to build more because they have incredible institutional knowledge about the problem. You know, if you had somebody that's been thinking just about hospital addresses for 2 years, they can do so much more. And so we really think about it as an offset of other costs, and our customers appreciate the continuity, frankly. If they've been working with us, and a lot of our customers kind of have bespoke problems. Why does this doctor want to take my competitor's patients over mine, right? When they're
Mhm.
booking appointments. We can help them with those individual problems, and they really get to know the data scientists that they're working with, and they know their businesses well. And so I think they value that as well and are willing to invest a little bit in our team in addition to the technology.
Yeah, those are two really powerful things. I'd like to talk with you offline at some point too about covering the health premiums. I mean,
Mhm.
from an economic standpoint, it's really interesting, right? Healthy workforces can work, and then, of course, produce more things, and so that's good. And
Yeah.
so that's an interesting approach, and I'm really happy to hear that it's working. You are very committed to health equity and equity in general. You talk about it a lot. One of the concerns that we see, though, is that AI and machine learning and data and technology can, have privacy exposures to, especially to minority groups. AI can be trained in a way that discriminates. I mean, how have you overcome some of these problems?
Yeah, I mean, AI is a tool like any other tool, and the machines are incredibly powerful, but they do what they're told to do. And so,
Mm,
what I mean by that is if you have an engineering and innovation team that is building with profit in mind, and they're not thinking about bias, and they don't have objectives set out for things like making sure the outcomes are equitable, you will get a profit only answer, right? Because that's what you've asked the machine to do. If you ask these tools to build things with equity and bias in mind, and you put the right safety procedures and checks in place, you will get an outcome that reflects that intention. I think one of the most impactful things we did was we actually built our data science team to reflect the communities of people that we serve. That means we have women and people of color and underrepresented groups on the team building the algorithmic approaches, interacting with the AI, building our safety procedures and our bias testing. And they understand the impacts that those biases can have because they've seen them in their own lives. And so I think that really democratizing the people who are building these tools and having all parts of our community reflected in the teams can be a really powerful way to prevent unintended or harmful outcomes.
One of the things, and I was actually just speaking with someone else about this, and so I'll ask you as well. A lot of hiring managers like the idea of having more diversity on their teams, but when it comes to the actual hiring process, it's like, oh man, I got like 5,000 applicants.
Yeah,
I just want to use the AI screener and have the AI screener just go through, right? And so
yeah.
it's kind of like they're in this position where they know they need to have diverse teams. They see the performance of diverse teams in their company and how it excels, but the hiring process is tough.
Yep.
Did you have experience with this yourself? I mean, I'm sure you did as a founder.
I mean, two things. One, ask the question is who is building those AI screening tools, right? Go and look on LinkedIn, see who's building them. And if they don't look like the teams of people you want to hire, it's an indicator that maybe that's not the right tool for you.
Mm,
I think the other thing is just, I'm a woman. I have an understanding and I've seen in the literature, Harvard Business Review has study after study that if you look at a job description and women will only apply, and a lot of this tracks for people of color as well, if they meet 100% of the qualifications.
mm,
Men will apply if they meet 50% or more of the qualifications. So there's a selection bias of people who will apply for your job. And so in order to get more diverse teams, you really need to do some outbound recruitment.
mm.
But once you get those first few key employees, they will bring talented friends. They will make referrals and bring talented people to the company. But it is some legwork and just understanding that folks respond to job applications differently. And so if you really want that talent, you might be looking at the same level of talent, but one person will choose to apply and one will not based on their background. And so um, some of the things that we did were really doing some of that outbound recruitment, incentivizing our employees to have referrals. We give a referral bonus. So if someone refers in someone and they get hired and they stay for a period of time, they get a bonus for doing that. And so that incentivizes people to bring talent to us kind of outside of the big pipelines digitally that are available online now. And so we get a more diverse pool in that way.
Wow, that's actually really so. One of the things I've taken away from the conversation is that you, as a person, and now I'm sure, of course, you're a co-founder, and then throughout the company, you kind of take a very scientific approach to things
Yeah.
because a lot of people with the hiring process, right? Like I said, you just kind of type out the application or the
Mhm.
description and you put it out there, but you're actually thinking about the people who are going to be seeing the description, how it's impacting them, and then, of course, all of your data has PhD data scientists that
Yeah.
are kind of assigned to work on it. Why do you think that you are that way? Is this something, a personal experience that you've had, or upbringing? What has geared you to this kind of pragmatic approach?
Oh, man. I mean, not to be cute about it, I do think like I grew up in Cincinnati, Ohio. Like there is some Midwestern pragmatism of just trying to get things done and looking and seeing what works and being committed to doing the thing that works, not necessarily the thing that you wanted to do. Um, was a part of my kind of cultural upbringing. It was that hard work will get you to the end game that you want, and you can't kind of be committed to a certain way of getting to the outcome. But I think the other thing is, in a background in policy, I worked with a lot of members that were really bipartisan.
Hmm.
And in an age when, now it's hard to imagine, but when I came to DC in 2005, a lot of the members that I work with pretty much lived there. And so Republicans and Democrats' kids played on the same T-ball team. So they talked a lot and they respected each other more. But one of the ways that really brought people together was data,
Hmm.
right? If they could both look at information and agree, like, okay, this study makes sense. We both believe that Harvard Business Review is a good entity to look at for labor market data. Now we can talk about, we might have different approaches to solve the problem, but we can all agree on kind of what the problem is and the data is. And I I think that's a very valuable way to problem solve in a company because it's not personal, the different perspectives people are bringing to the table. We're all looking at the information. And, the one characteristic when we hire people that we ask our people and culture team to look for is folks that are willing to change their mind with new information. So we don't get kind of too attached to a perspective. We're kind of letting the numbers show us the next place to go.
Yeah, that is so, and that's important of executive teams and teams everywhere. I mean, that's really, I think, a really common roadblock we see is entrenched ideas
Mhm.
over many years, and there's a lot of reasons. I'm not saying it's bad to have entrenched ideas, but in this innovative age where things are moving quickly, sometimes we need to be agile, and that
Yeah.
kind of follows up to the last question. I really appreciate your time today. Where do you think the future is going in the healthcare space in terms of data? Where with AI, we're eventually going to run out of data, and to train, AI in the greater, data environment. But specific to healthcare, what do you think is going to happen next?
Yeah, I am an eternal optimist. So I will give you my optimistic view of the future of AI in healthcare because I think more people are going to run towards being a part of the solution to this challenge. I think what we're going to see is the dream of personalization, of your healthcare working uniquely for you and you being able to find the providers that are uniquely suited for you and the treatments that are suited for you is going to become more and more a reality every day. And I think when patients see the positive impact on their own health and wellness, they will start to embrace technology, but it has to work for them. in order for that kind of future forward view and AI acceptance to really come to fruition. And that's my advice to all other kind of founders in this space is when we do right by patients at the end of the day, we're building the industry acceptance for all of us. And so if we continue to deliver value to them and respect their privacy and deliver things that are equitable and really make their own healthcare better, we're just on a journey that's going to be a really exciting one.
I really like that approach to things because the fee for service model is no, as we know, it's no longer really working, and it's eventually going to go away. And so the challenge is figuring out how can we make patients enjoy preventive care, how can we
Mhm.
make them value preventive care, and the current system makes preventive care challenging, right? And your system, what I love about it is it makes it very seamless, having that access to data on the patients, and it also helps the staff of industry insurance companies like Humana
Yep.
help their patients and members. So that's a really great approach. We're going to have to include that in the write up for this because it's something that I've been trying to say for a while. Right, is we need to take like an Apple or an Amazon approach
Yeah.
to our members' experience. Really appreciate you coming on, Megan. I hope we can have you back on again.
Anytime. I appreciate the conversation. Thanks so much.